All right, one of the hot topics currently in the media, it's 2010 right now, it comes up a lot about people being addicted to pills or prescriptions. What can you tell us about that?
Well, that's a huge thing right now because we have multiple prescriptions being filled, Oxycontins, Percocets, all of the opiate-based drugs, and the denial around it that we find with our clients, and we've been seeing more and more of them, not only amongst the youth, but middle class, upper middle class females. It seems to be a little bit of an epidemic. In fact, more of a big epidemic. Little would be minimizing it. I'm not an addict because I have a prescription, and yet the results are the same. And once they start using the pills, then they find themselves going from this doctor to that doctor. Anna Nicole Smith is an example of somebody who had multiple doctors. Michael Jackson, multiple doctors. They're taking, our clients will come into us, they'll be on pain pills, anti-anxiety meds, clonidine for high blood pressure. All of those slow the respiratory system down, and that's why these people are dying. It's an epidemic. I mean, there's ODs all the time. Not intentional. It's a little different than slamming heroin or snorting or smoking. The denial is, well, I have a prescription. I'm not doing anything wrong. I'm not an addict. Don't call me a drug addict. And yet, that's exactly, I always tell people it doesn't matter how you got here, what highway you took in to get here. You're either an addict or you're not, and that's the problem with prescription. It's widespread. We have doctors writing scripts, handing them out like candy.
Tammy didn't mention it, I think, the issue of sleeping pills, too.
Oh, yeah, sleeping pills.
That's a big issue these days with addicts and others. And it kind of goes back to the question we were talking about earlier, the physiology of the person. There are research has indicated there's cross-addiction and cross-tolerance, and once we set up our body, central nervous system, liver, and brain in particular, with these addictive changes, it'll continue to have problems regardless of it's pills, prescriptions, non-prescriptions, alcohol, whatever.
And the problem with the doctors writing the prescriptions for the nice-looking lady that comes in with a hurt back is, well, I'm not an addict. I have a prescription. And yet when she wakes, or when she doesn't wake up, when she's dead in her bed, and, here's another OD, Heath Ledger. I mean, there's been a lot of celebrities that have brought attention to this issue. Adderall is another big one out there. We see amongst the Hollywood crowd as a way of keeping thin and thin. They'll go to the doctor and say, I have adult ADHD, and they'll get a prescription for Adderall, which is amphetamine. Back in our day, when it was, the roaring 70s or 80s, we were all popping black beauties and doing amphetamines the old-fashioned way. Well, now everybody does it through Adderall or ADHD or ADD drugs, and they're equally addictive, and you might as well be snorting some crystal meth.
Well, it sounds like these pill and prescription addictions are almost quiet addictions where people can be addicted to it, and then literally the person ends up dead before they start realizing that the person had addiction. It's not like an illegal street drug like heroin or somebody who's an alcoholic. It's a little louder and people notice their behavior.
Yeah, and let me just address one thing too. I talked about the middle class lady going in, the nice lady going into the doctor's office and saying I have a split disc in my back and getting a prescription, and that starts the journey. The other issue is our youth. We've had many young kids, 19, 20, 21-year-olds come in addicted to Oxycontin. They start off at a party, somebody gives them some pills. Those are all opiates. So it doesn't matter in what form you get it. Heroin, Oxy, Percocets, Vicodin, those are all the opiate-based. Some of those aren't even synthetic. We're talking the very same drug, just in a different form and a different amount, dose. So you have kids that start off at mom and dad's, when they're out of town, and then they start going through the cupboards, and they'll get them. And, pills on the street have a value of anywhere from $5 to $20 a pill. So if you're the dude that has the prescription for 90 pills for a month, think about how much money you're making. So if you're the dude that's using the pills and you're 19 years old, you may or may not be able to come with that kind of cash to sustain that habit. So if you can't, you're fully addicted, and you're at your buddy's house, the next thing you know, you're jonesing because an opiate withdrawal is a terrible, terrible withdrawal. He says to you, here, take a hit of this, and it may be a nose hit, it may be a smoke hit, or a main line of heroin. The next thing you know, your child, who could be going to one of the best colleges in town, is addicted to heroin. opiates, snorting them, smoking them, or whatever.
You know, one of the things about the opiate pill use too is it often leads to heroin use because heroin is less expensive.
Yes.
generally speaking.
Yes.
Sure.
Especially amongst our youth.
So they're sitting there getting an expensive high through, say, OxyContin or some other prescription drug, and that's expensive in terms of dollar bills being laid out. Then they progress to the street drug, essentially heroin, for a low price, so they can still get their high, but then they're addicted to something it's less expensive, but probably even more deadly.
Absolutely, because you have no idea what grade you're getting, what it's been cut with, and it changes every time, which is why our young kids wait, you know.
Another
Excuse me. Go ahead.
Another piece of that we're seeing is a young person will come in, or may not come in, and those who are on the street getting the prescriptions, as Tammy said, those pills get pretty expensive, so they're going to dealing. They're going to selling those drugs if they're not using them themselves.
Sure. So then they go from being in the addict world, but also in the dealing world. So before you know it, there's more problems cropping up. So it's not just the addiction; it could be illegal drug dealing, and of course, then the law gets involved, and then their lives really get to be bad.
Yeah, and generally what we see is them doing both, using and dealing.
At the same time. So it's the double whammy.